If you've worked in treatment for any amount of time, you've seen it happen. A patient walks out against medical advice or just never admits at all, even though everyone around them knows how serious the situation is. Families are desperate, clinicians are frustrated, and the system seems to hit a wall. That's where we come in. At Robinson & Casey, our firm partners with treatment centers, interventionists, and behavioral health professionals all throughout the country to support your work, not replace it. Our role is to reinforce what you're already doing clinically by providing structure, accountability, and enforceable treatment requirements through the Marchman Act. The Marchman Act isn't about punishment. It's about protection. It gives families and treatment providers a lawful path forward when judgment and insight are impaired, and the risk of harm is real. Here's something many people don't realize. The only legal requirement for someone to be Marchman Acted is that they're physically present in Florida. That means if you can get a patient here, we can use this law to help protect them and support your clinical team's efforts. Think about your own facility for a moment. How many patients leave AMA, even when they're clearly at risk? How many never admit at all, despite every clinical sign that they need help? How often does your team recognize that impaired capacity, not defiance, is what's driving the refusal? And when a patient is leaving AMA or refusing care, what kind of assessment is being performed by the clinical team to determine if a Marchman Act might be appropriate? These are the moments where the Marchman Act can make the difference between relapse and recovery, between crisis and continuity of care. When a facility understands how to integrate the Marchman Act process, AMA and non-admission rates drop, clinical success rises, families gain trust knowing their loved one isn't left to chance. Our team educates staff on how to recognize when the Marchman Act applies, how to communicate that option compassionately to families, and how to ensure that once a client admits, they remain in treatment long enough for the work to take hold. At Robinson & Casey, we believe every facility should have this in its toolbox, because when insight is compromised, leverage saves lives. If you'd like to learn more about how we can support your admissions or clinical team, reach out to us at Robinson & Casey. We've been there, and we're here to stand with you.